So infant reflux is very common. It happens pretty often, and I would say at least 90% of the time in most newborn babies. And what we're talking about is essentially the relaxation of that lower esophageal sphincter that kind of allows gastric contents, milk, formula, up into the mouth and then out most of the time. For infants that have reflux, and they're gaining weight really well, they're eating well, they're growing, they're meeting developmental milestones, and they seem unbothered by the reflux, we tend to just call those baby happy spitters, and we monitor them. Reflux usually peaks around 4 months of age, and then you start to see an improvement as they start to get some truncal control, can start to sit up by themselves, hold their head, that kind of thing. Usually it's gone by a year. Some babies I've seen can happen after the year mark. That's not uncommon either. Complications, or I call them red flags, associated with reflux include feeding refusal, back arching, fussiness, feeding difficulties, vomiting, poor weight gain, irritability. Sometimes you can get some respiratory symptoms, difficulty sleeping, bloody stools. Those are all red flags that need to be evaluated by a professional. Certainly you can come to our office and we can kind of discuss next steps. From a medical intervention standpoint, depending on what the symptoms are, depends kind of on the treatment plan. What we want to make sure is that your baby's happy, healthy, gaining weight, meeting milestones with doing the least invasive testing that we can. And that will differ for every family. Traditionally, we like to treat reflux pretty conservatively, whether that's thickening feeds, trying different feeding positions, and that can be discussed in our visit. Infants who are having poor weight gain and crying, feeding, choking, gagging with meals, those require some evaluation, and certainly we can discuss those topics in our visit. Reflux is very common, especially in infancy. Peaks around 4 months of age and then tends to get better. Red flags, which would prompt you to seek evaluation, would be profuse fussiness, crying, feeding difficulties, feeding refusal, poor weight gain, irritability. If you just feel like your baby's not acting like a normal baby should, that may warrant some further investigation as well. But we are here at the Richmond campus, and if you have any questions, please don't hesitate to reach out to our office.